everyone, and welcome to the International Interprofessional Mentorship Program. My name is Kate Barlow, and I am the founder and host of today's program. It's April 4th, 2023, and today Amy Brewis is here to talk about primitive reflexes and the connection to behavioral and learning challenges. Please mute yourself during the presentation, and you can unmute yourself whenever you have a question, or you can type your question into the chat box and I will answer your question. I will ask the question for you. Please remain on the webinar till the end in order to receive a certificate of attendance, and I will be putting the link in the chat box momentarily for you to do the survey for your attendance. So thank you so much for coming, Amy. We are so thrilled to have you today. I'm just really looking forward to this presentation myself. So please introduce yourself.
Thank you, Kate. Thanks for inviting me to come and talk today. I'm excited to share this information because it really is a passion of mine. So like Kate said, my name is Amy Brewis. I am the owner of a company called Brain Fundamentals, LLC. I'm located in Westborough, Massachusetts in the United States. And I work with children who have learning challenges, autism, dyslexia, all sorts of any child who struggles, basically, anxiety, things like that. And I use a movement-based program doing a lot of primitive reflex integration. I use brain gym. I'm a licensed brain gym instructor and consultant, so I do a lot of brain gym as well. And it's really just working with the underlying imbalances or neurological underdevelopment in the lower centers of the brain and making that work better for kids. So I am going to be doing some movements, okay, and up and down. So I invite you to join in if you feel comfortable with that. So I will be up and down a little bit. I do have some videos as well, but anything that you feel comfortable joining in with, I invite you to join in with me as well, okay? So there's me. I'm going to jump right in with an activity called PACE. And PACE is from the Brain Gym program. It is a 4-step warm-up process that gets us, our brains and bodies, ready for what we're going to do next. And because we're all learning here, I always like to start with PACE. And the very first part of PACE is to drink water, sipping water. And you can see that PACE actually goes backwards. So the acronym actually starts with the E and goes CAP, but it's really PACE. So the first step is drinking water. Just sipping water is important for our bodies. And it helps those electrical connections in our brain and our body to work better. Okay. And then the next part is called brain buttons. And brain buttons is a way to help bring visual awareness to our midline and also to help our kidneys flow better. So what you want to do is find your collarbone, and then right underneath your collarbone are these soft spots. And with one hand, you usually use middle finger and thumb. You're going to put your hands on those soft spots, and your other hand just goes on your belly button like that. You could do this. I'm doing this sitting. We often do it standing. And as you're rubbing these brain buttons, I invite you to move your eyes left and right. So you're giving this visual reference of the midline, right? So these brain buttons match up to our eyes, and it helps to give our eyes this reference of where is my midline, okay? Keep those eyes left and right. And then we're just going to switch hands. So the other hand goes on the brain buttons and the other hand is on your belly button, and just keep those eyes moving left and right. Okay. The next one, I'm going to stand, but if you remain sitting, that's fine. This one is a cross crawl. This is bringing some cross lateral activity. So it's just hand to knee, or you can do elbow to knee, just crossing over that midline, right? Getting both sides of the brain activated. You can do feet if you're standing, okay? Just getting that cross lateral movement in, right? And the last one is called hookups. And for hookups, we start with our thumbs up, and then we cross them over, thumbs down, cross, link your fingers together, draw them up to your chest, and one leg goes over the other, crosses at the ankle. So if you're sitting, you can just cross your legs over the ankle. And then your tongue goes to the roof of your mouth, like where you would click. So that, put it up there and just hold your tongue up there. And take some nice deep breaths in this position. And then the second part of hookups, you're just going to place your fingertips together. So just placing your fingertips together like this. Sometimes you can feel a little pulse here. Sometimes I do like a tap, tap, tap individual fingers with kids. It'd be surprising how difficult that is for some children. And then I usually end with, this is a metaphor for bringing both sides of the brain together. So I usually end with, put your brain back on and make a cool sound. So we just put our brain back on and we're ready for what we're doing next. So that is PACE. I start every session with PACE. And it's a great way to just get everything ready and going. All right. I see there's a question in the chat, Kate, is that, or something's in the chat?
Yeah, sorry, it's just the attendance link.
Oh, okay. Got it. I'm not looking at the chat. All right. So next, this is what I call the developmental building blocks. And this is just to give you a sense of where I'm talking about when we're talking about the parts of the brain, okay? So down here at the bottom is our immune system, digestion and gut health. And the reason why this is on this pyramid is because this is like our systems. This is our brain wiring. And if our digestion and our gut are not in a good place, or we have some kind of underlying physical issue, then our body and our brain are constantly being put in a state of stress, in a state of fight, flight, freeze. And all of the things above it are going to be affected. So I don't work directly with this bottom layer with digestion and gut health. I refer people out to doctors or functional medicine or things like that. But I just to understand that, because this is the level where I'm talking about today, is these reflexes. So this is the sensory processing, and we have primitive reflexes, which are there for survival and for development, which we'll get into. And then we have our sensory systems, our vestibular system, right? Our balance system, or where am I in relation to gravity? Where's my head in relation to gravity? The proprioceptive system, the input from the muscles, our muscles and joints that we receive from our muscles and joints to help us know where we are in space. The proprioceptive system also helps us to know how much force to use when we throw things or pick up things, stuff like that. And the reflexes and the sensory systems are very closely tied together. So that's why they're on this same level. So when I'm working with reflex integration and we're talking about reflex integration, the sensory integration all kind of happens at the same time, because if the reflexes are unintegrated or not finished in the brainstem, then the sensory systems are also affected. And then we get up to the later development, and you're going to notice these colors as I go through the presentation. This red, the green, the blue, and the purple is going to flow throughout the presentation. So you'll see how this all ties together. So we get into our sensory motor development, eye-hand coordination, posture. This is basically moving up towards the levels in schools or in kids, right? So this is, these are like baby up to about a year old. We're working on that sensory processing. Then we get into the early development of, like, for here, it's like kindergarten to grade 2, so about 5 to 7 years old. And then we move up into the later elementary with our development, organizational skills. And up here is that highest prefrontal cortex, right? Our executive functioning skills and intellect. But again, the reason why I bring this up is because if we're working way down here at these underlying issues, then all of the things above will be affected. All right. So this is a theory called the triune brain theory. And this is a modified version. This has been simplified for kids with very simple language that I use with kids. So you might have heard the triune brain theory before, but this is a little bit different language. But the idea here is that we have these three main parts of our brain. Okay, we have the baby brain, or the brainstem. We call it the brainstem, but we call it the baby brain. Okay, and the baby brain is the first part of the brain to develop in the first year of life. Okay, when we're in that horizontal position for the most part. And the information comes in, all our sensory information is first received by the baby brain, by the brainstem. And then it goes up to the emotional brain. So we call this the emotional brain, or the midbrain, right? But we call it the emotional brain because it's in charge of our emotions. This is where our amygdala is housed. But as that sensory information comes into the baby brain, it goes up to the emotional brain, and the emotional brain is like the gatekeeper, right? And I tell kids, it's like the emotional brain is like, wait, I need to know whether this information, all the sensory information that's coming in, everything except our sense of smell, is coming in through the baby brain and going up to the emotional brain. The emotional brain's job is to decide, is that information safe, familiar, comfortable, or is it a threat to my survival? Okay, and a threat to my survival can be a perceived or a real threat. So the brain doesn't know the difference between a perceived threat and a real threat. So the emotional brain's job goes, wait a minute, can I let this information go up to my higher centers, which is the thinking brain, where I can process it, right? The cognition part of it. So if the emotional brain decides that that information is safe and sends it up to the thinking brain, that's where we're able to process the information at a higher level. We're able to access our thoughts and access that reasonable action, right? And these positive hormones are released and gets it up there. However, if the emotional brain decides, wait, hold on, I don't like this. This is scary. This is unfamiliar. This is embarrassing. It's going to send it back down to the baby brain, where we react with the fight, flight, freeze response, that stress response, right? And that's where all those, nasty hormones like the cortisol and adrenaline start pumping through our body, and that can cause all sorts of issues. And of course, if we're in a state of stress, we're not going to learn as well. So the idea here is just to remember that the emotional brain is the gatekeeper. We want to be able to get up to our thinking brain, but the baby brain is the one that can be in charge if we're in a stress response. The baby brain is also where those reflexes are housed. So guess what? If the reflexes aren't fully integrated, then the baby brain is not as organized. Those little neural pathways getting up to the thinking brain are all mixed up and tangled, and it's not going to get to where we want it to be. So by working at the brainstem level, at the baby brain level with those reflexes, we're working to get those movement patterns automatic, okay? And helps to get us up to our thinking brain. Okay. The last part, and I don't put this in the three parts of the brain, but I do like to talk about the prefrontal cortex, which is the executive brain. So remember the pyramid, right? The purple right at the very top is the executive brain. And the reason why I put this in here is because the executive brain is the last part of the brain to develop. It's part of our thinking brain, but it doesn't fully develop until we're in our 20s. And so we think, we have all these kids who we say, oh, they have executive functioning deficits, but if their baby brain is still not fully disorganized the way it should be, they're not getting up to their executive brain. They're not even making it to here to here. So it's just something to consider that, these kids, the executive brain is the last to develop, and we want to make sure we're going bottom up. And we'll talk about what that means. Okay. All right, I'm going to keep going. Please ask if you have a question. You can put in the chat. Kate's monitoring the chat. Otherwise, I'm going to just keep going because I have a lot to get through and I want to make sure I get everything to you that I need. Okay, so the baby brain from the bottom up. So I talked about we're working with the brain from the bottom up. So when we think about the reflexes, we want to start at that bottom of the pyramid, well, not the immune function, the second layer up, right? And working to integrate those reflexes so that we're building those neural pathways from the baby brain up to the thinking brain. And these are all, different reflexes. This is the STNR. We'll talk about a couple. This is the ATNR. This is the Moro, and this is the TLR, right? Okay, I think I got all that. So now let's look at this a different way. So here's that pyramid. Here's the 3 parts of the brain with the 4th included. And look at how this relates now to a tree. And we're going to look at this a little closer so we can see kind of what's really happening. So functions of the baby brain. So we have what I was talking about. There's the reflexes for survival. Some are for survival, some are for development. So these are more the postural reflexes versus the survival reflexes. And then there's our systems. We have more sensory systems than the vestibular, tactile, proprioceptive, but these are the 3 that tend to be most affected when the reflexes are underdeveloped. And so these are the 3 that I work with. So these are all housed in the baby brain, in that brain stem, all right?
Amy, I'm going to interrupt you real quick for a question.
Yep.
With the midline exercise, do both hands move? I could not see what the hand on the belly was doing.
No, for this one, it must be brain buttons. Yes. So this one, no, hold this and rub this. Good question.
Thank you.
Sure. Okay. So, emotional brain. So then we have our emotional brain. So here's our posture, eye-hand coordination, just zooming in basically on all the things that are on the pyramid: balance, body awareness, visual and auditory. This is all in the emotional brain, the midbrain. And then we get up to our thinking brain, which I included the executive brain because it is all part of it. So the blue and the purple, right? Visual, spatial, organization, language, all of these are in the thinking brain. Now, this is where we start to say, all right, we have a child who comes to us, or the teacher or the parents are saying, well, they have executive functioning difficulties. They can't keep track of their belongings. They can't, organize themselves. Their room is a mess. They're not able to plan and organize themselves. And they have social skills deficits, right? They don't know how to interact with others. They can't, they don't know how to play with their peers, that sort of thing. So this is what we see. This is like where kids, the main thing that teachers might see or brought to their attention, right? And so we look at those things first. And so what we see happening at the top level is this, right? So this learning and knowledge is going into the tree. It's going to get sucked in there, right? And it's supposedly going up to the branches of the tree. And what we're seeing is that these social skills and executive functionings are not happening as well. So those are the leaves that we're seeing at the top of the tree, right? That are falling off. But now let's dig a little deeper. Okay, so now what we might see, one second. Okay, so now we start to look a little closer, and we maybe talk to the teacher about it, and we say, they say, their organization, they really struggle with organization, and their language, they really, they have a lot of difficulty communicating their needs or communicating with others. Okay, and then we bring them to an OT or someone like that, and they might say, their posture, they're always slumping over their chairs, or they just can't sit in a chair, they're always falling off. And their balance is horrible. They're in, PE class and they're trying to run around and they can't even maintain their posture on their feet. They can't even stay up on their feet. Eye-hand coordination. Anytime they're trying to, throw a ball or catch a ball, they just can't do anything. So we keep looking deeper, right? And then you might talk to an OT or someone like me, and I say, their vestibular system, their vestibular system is underdeveloped. And their proprioception, they don't understand where they are in space. They have no idea. And really, it's these reflexes, right? Because when you start to know what to look for and you're looking at these reflexes, this is where it's missing all down at the bottom. So now we really have, as we look closer, all of these deficits when we really start to look a little deeper. And so what's actually happening as we do this is here goes this learning and knowledge, right? but the vestibular, the proprioceptive systems aren't working right. Those reflexes aren't developed. And so as this learning and knowledge goes in, it doesn't even get past the roots of the tree. Okay, so it's getting stuck there. And this is really what's happening. All this balance, eye-hand coordination, posture, language, organization is really just looking deeper at what's really happening with a particular child or person. This doesn't even have to be kids. This can be adults too, right? So we're just looking deeper at what's actually happening, and it really goes down to those very root level with the sensory systems and those reflexes at the very bottom. Okay, so what are these reflexes that I keep talking about? Okay, so primitive reflexes are early motor patterns used as a survival mechanisms for babies in their environment. Most are developed before the age of 1. So there are a few reflexes that are not meant to develop or finish their job before the age of 3, but the majority are done in that first year of life. This is where that baby brain or brainstem is developing. Okay, if these reflexes do not complete development, higher functioning reflexes cannot take over. So we have lifelong reflexes that we want to be able to take over, and more sophisticated voluntary movements do not develop. So in other words, we may not be able to separate the movements from our arms or our hands from the movements from our neck, for example. Okay, and we'll talk about that, what that could look like. So if they're not developed, it can affect attention, posture, gross and fine motor skills, cognition, functional vision, communication, all of that, okay? Functional vision, meaning how well our eyes work together as a team versus like our vision being able to see 20/20. Functional vision, how well our eyes are working together as a team, all right? Let me get to where I am in my thing here. So, okay. So reflexes go through 3 stages, or we can think of them as going through 3 stages. The emerge, meaning it shows up in the body. It shows up first as a neural pathway in the body. All right. And most of the reflexes, or many of them, emerge when a baby is still in utero. Developed means that we've gone through this movements. We're working through the movements in the body to develop that reflex and to continue to integrate it, okay? And the integrating is finishing it, or when it becomes dormant in the brainstem. That's ideally where we want to be with these reflexes. We want them to integrate or become dormant in the brainstem. Sometimes, however, the movements get stuck, because ideally what we want is that just some smooth flow from emerge to develop to integrated with all these reflexes. There's a lot of overlap with the different reflexes, but we're not going to get into that today. But ideally what we want is for it to move along the pathway here. But sometimes what happens is they get interrupted or stuck. Now, there can be a lot of varying reasons for why a reflex might get interrupted or stuck, and nobody knows why exactly. There are theories, and I have my own theories. A lot of it can have to do with not enough tummy time or floor time in general, back or tummy, prone or supine, because the babies need to be rolling and moving and exploring their environment, not stuck in containers, not in the bouncy seats and the exercisers and all the sorts of containers that we put babies in, car seats for extended periods of time and things like that. It can also have to do with trauma in the mother during pregnancy, or trauma with the baby, trauma during the birth process can interrupt reflexes as well. So there's lots of different things that can happen. But movement is just really important. Getting the babies down on the floor. I tell anybody that I work with that works with babies or younger children, if you want to get one thing out of my presentation, is to get the babies on the floor, back, tummy, on the floor, moving, letting them explore the environment, not helping them when they can't roll over. And, oh, honey, I'll help you roll over. We need to let them struggle and let them build all those muscles and their flexors and extensors, all front of the body, back of the body, in order to move through this, because not only are they developing their body, they're also developing their brain. Okay. So what can we do, right? So we can take our body back in time using intentional movement. So we have neuroplasticity, so we can reorganize those brain pathways. So what we're doing is picking up the development where it left off so that we can move it along to integration, right? So picking it up where it was interrupted or stuck and moving it along to integration so it becomes integrated in the brainstem. It's like going back and checking off the boxes that were missed the first time around, basically. All right. And this can be done at any age. I did this work as an adult myself. So I work with kids, and I do work with adults too, not as many, but I do work with both. It can be done at any age. All right, so let's talk about our first reflex today. So the Moro reflex. So the Moro is, it's our earliest fight-flight response, and it's typically replaced by a startle response at 4 months of age. So the Moro is, if you have a baby on their back and you suddenly kind of drop them a little bit like this, or there's a loud noise, they're going to startle. And then they're going to come back to midline like this. So full extension of arms and legs and head, and then they come back into midline, okay? It is the part of the survival mechanism that alerts, arouses, and summons assistance for the first few months of life. The summons assistance is an important thing to remember here, because this can have an emotional component if the baby is crying and in a Moro response and does not receive the assistance from their caregivers, right? So think about babies who are in, a situation, maybe an orphanage or somewhere like that, where they don't receive the immediate assistance that they might be seeking as an infant. It's an involuntary reaction to a threat, okay, a wet diaper, hunger, and temperature. It's usually sensory based, but not always. But most, as babies, it pretty much is. But as we get older, it might not be. It is also thought to play a major part in developing the baby's breathing mechanism, and it facilitates the first breath of life. So when a baby is first born, the first thing a doctor or a nurse will do is whack them on the bottom or on the chest and get them to cry. And that's that Moro, right? That's their first breath. It's facilitated by the Moro reflex. If the Moro doesn't finish its development, it's going to present later on as that fight-flight response. So defiance, yelling, hitting, biting. Think about the fight-flight of the fight-flight freeze. Okay. So here's a little video, and let's see if this will play good for us, Keith. This is just demonstrating the Moro.
Listen to Moro reflex by having him relax, unsuspecting, and then give him a sudden stimulus, and there's a good Moro, quiet and headline midline, and then just give the stimulus of dropping him back a few inches, and that's a good normal response. Okay.
Did that play okay, Kate? Okay. All right. So that's just an example of the Moro. That he says Moro, but it's Moro. Now I want to show you an over response. Okay, so this little baby is going to put himself into a Moro response, but watch what happens. So he's just kind of hanging out, chilling, seeing what's going on. Watch what happens here in a second. So you could see with that one, right? He sneezed, which put him into that Moro response, but he got stuck there. He got stuck. He wasn't able to come back to midline. He wasn't taking a breath. His face was turning blue, right? So he just got stuck in that extension and could not come back. And this is what can happen, is we can get stuck in this extension or not be able to move fluidly through this reflex in our bodies and get stuck, and it can cause all sorts of problems. All right. Whoops, I didn't want to do that. All right. Next. So a retained Moro reflex. This is just some pictures to give you a little sense of what can this look like in kids, right? This fight, flight, right? We're just responding with this fight, flight, meltdowns. We might have be hiding from sensory input. These are the kids that are going to cover their ears when there's a loud noise. These are the kids that might have a meltdown with a change in routine. So this is important too, is that when you have an active Moro, a sudden change in routine can activate that Moro, because it's like this sudden sensory, or it's just a sudden change. And that can also, kids with Moro want to control their environment and control themselves around them because they don't feel safe. And so if it's a sudden change that's out of their control, that can also set that off. All right. But oftentimes it's sensory driven. So here's some, I'm going to kind of go through these quick. You'll get these slides afterwards, so you'll have all this. But low tolerance to stress, tend to have tight muscles in the back of the body because of that extension, getting stuck there, continuous anxiety, tend to over or underreact to fears or small things set them off, be very moody and emotional, okay, problems conforming to rules, eyes constantly scanning for safety. So when we're in Moro, our eyes are going to scan the room looking for danger, maybe aggressive and violent as we get into puberty, poor adaptability, so sleeping difficulties, all of these, difficult to settle at bedtime, all low self, so you can see these allergies, digestive issues, picky eating, all of these can be associated with the Moro reflex, right? Constant state of stress when we are in the Moro reflex. It's closely tied to another reflex called fear paralysis, which we are not going to talk about, but the fear paralysis is the freeze part of the fight, flight, freeze. This is the fight, flight. So we're in this constant state of stress, constant stress hormones pumping through our body, and can cause all of these kinds of issues, which of course, learning and behavior are affected. Okay. So here is a movement that we can do. And this is one of my little kiddos here. This is called the superstar. And it's just moving in and out of that reflex, right? So moving in and out of that flexion and extension with whole body, arms, legs, head, coming in and out of that movement pattern. Did I miss one? Page. I think I missed one. Wait a minute. Yes, I missed one. Okay. Hookups is the other one. So this was Superstar that I just showed you with the little girl, and I skipped this, so my apologies. Hookups is the first one that we did in PACE, where we crossed our arms like this and brought them up, and the legs go over, one leg over, and the tongue goes to the roof of your mouth. Let me explain to you a little bit about why hookups can help with the Moro. So when we are in a state of fight, flight, the attention is drawn to our extremities for that fight or to flight, right? So when we do hookups, we're drawing attention back to our midline and sending this message to our body that I'm safe, it's okay, I don't have to fight and I don't have to flight. So it's just bringing it back to our midline, bringing it back to that sense of safety, and it can help to integrate the Moro reflex and calm that nervous system response, that sympathetic, it's a sympathetic nervous system response. Okay. One of the other things I do, if you work with kids, when you do the second part of hookups with this, I often will do like, pretend like we have something, like we're holding a cup of hot chocolate or a drink or something, and then we smell it. And that helps to bring in the deep breathing, right? So just, oh, that smells so good, right? And then bringing in that breathing as well. All right, just an idea there. Okay, so we saw the Superstar. And the Superstar can be done in a chair too. So you could do that right here, just bringing arms and legs out and coming all the way in like this. So this can be done in multiple positions. All right, and it's just bringing everything together. Kids who have poor, low core strength are going to have a hard time with this as well. Okay. The next two are brain gym movements as well. And the first one is belly breathing. And belly breathing is really just breathing into the belly, because when we are in, I'm going to turn this way so you can see my belly. When we're in a state of stress, right, we often breathe up into our chest. So when I tell kids, take a deep breath, they go like this, but we're not breathing deep into our lungs. So belly breathing is just forcing the air down into the belly. So I'm expanding my belly and then pushing it back in, right? So I'm expanding the air into my belly. This is really tricky for someone who's in a big state of Moro, is working on that belly breathing. You can do that also lying down, having them lie down on the floor, put a little stuffed animal or something on their belly, or just have the person lie on their belly and have hold their hands there so they can feel the belly rising and falling. Because you'd be surprised how many people in the Moro do not have regular breathing patterns, and this can help to reestablish those regular breathing patterns. And the positive points, this is another brain gym exercise. Positive points, if you hold your fingers right above your eyebrows, it's kind of doing like 2 or 3 fingers right above your eyebrows, and then just gently pull the skin taut between them. There are neurovascular points right underneath your fingers. And what you're doing is helping to draw the blood away from the baby brain up to the thinking brain. And just holding these points, I'm going to stop talking for a second, just hold these points and breathe. So that can be very calming and relaxing. If we had time, I'd let you hold it for a couple of minutes because it can feel very nice. You can also do this for people, so you can hold their positive points kind of from behind. You can also hold one hand here and one hand like at the base of the neck and hold it for them like this, or teach them how to do it like this, because this can be very calming. A lot of kids like this, where it's 2 hands, feels very soothing as well. Sometimes I even do this in, like, when I work with kids, I have a parent with me, and I'll have the parent do this on their child, and then I do it on the parent, and we have a little chain of 3 going, which is really nice for both the parent and the child. But it helps us to get to a point of responding, right, in the thinking brain instead of reacting down there in the baby brain. Okay. These are some ideas for belly breathing. There is a website called copingskillsforkids.com. You'll get it in the slides. But copingskillsforkids.com has free printables that you can print out, all sorts of different ones that help to guide you through breathing. So you can use those as a visual. And then I just have this little, like a little starfish song that I sometimes use when I'm doing the Superstar, just to keep kids, you just sing it to the tune of Twinkle, Twinkle, Little Star, if you're familiar with that. Just an idea. I like to give ideas of fun ways to do this. And then here's some more ideas. When we are thinking about the Moro, anything that challenges that sensory systems, right? Because remember, it's triggered by sensory input, so noises and lights and all sorts of things like that. So I'll do loud toys. So these toys, when you hit it with a racket, when you hit the ball with the racket, it makes a loud booming sound. This is a modified Superstar, which I'll show you. There's a quick video after this that you'll see. Fabric tunnel. This is it's like t-shirt fabric that's tubular. So when you use it, it stretches, but then I have the kids, I'll wrap them up in it like this. They can actually see through this rather well, and we'll go through the tunnel and just bringing in that deep pressure, that hug type feeling, right? An exercise ball. you can do having kids like wrap around the exercise ball on their tummies. They lay on their tummy and wrap around it to build that flexion, right? And you're trying to pull the ball out from under them, or you can have them go back if they're here, right? If they're in this flexion and you want to build extension, having them lay on the back of the ball and doing some rocking and things like that, just to open them up, because so many kids are here and we want to just be able to get them back out, right, out of that flexion. Blowing activities, so anything that helps to develop those breathing patterns, like I said, are fun. These are blow pens that I bought that blow when you spray. When you blow, they spray like spray paint on paper, and just scarves, blowing with them. Let me show you the modified superstar. So this is just a playful way with using a balloon, just a simple balloon. So I have the child just lift everything up, right? And I'm just kind of hitting the balloon up. And then they do this for a little bit and they get tired. And then I say, okay, just relax. And they lay out like this, right? And then come on again. Okay, bring everything back up again. Here's a balloon, encouraging them to just build that flexion and extension. And you can see she loves it. She's just like, keep going, right? So it's just a fun way to do it with a balloon and getting to that flexion extension. Okay. All right. Do we have any questions, Kate, before I continue on with the ATNR?
Nope.
All right. So ATNR is the next reflex we're going to talk about. And this one is also called the fencer's reflex. And you can see this little baby here is in the ATNR. So what happens is as the baby turns their head, the arm on that side will extend and the other one will flex. And the same with the legs. Okay. They turn their head this way and it's going to switch. So this develops a couple of different things. So it develops muscle tone, stimulates the vestibular system as we're turning our head, and increases connections in the neural pathways, right? After birth, the ATNR ensures a free passage of air when the baby's lying on its stomach. So as you put a baby prone on their stomach and they turn their head, this arm should extend. So now I have this free passage of air, okay? Rather than my hand being here and blocking my air. The ATNR serves as the first eye-hand coordination experience, and this helps to build our near point focus. As we turn our hand like this, and we're looking at our hand, the babies will wiggle their fingers, and they'll look at, it's like, oh, I have fingers. And then they'll look out to the distance, so they're building their far vision, then they're looking back, oh, there's my fingers again, right? So they're starting to learn, where am I, and where's my eyes, and where's my hands? It's an introduction to laterality, right? Both sides, training the body one side at a time. I'm sorry, that didn't come up there. Okay. This is just some pictures to show you kind of atypical development, right? So this baby has his head turned to the side. This arm should be extended and it's not. He's all like this. These two children are mine. These are my two boys that are now 17 and 19. One of them, this one, is on the autism spectrum. This is a typical 19-year-old in college. So one of the things I like to point out here is both of my kids had an atypical ATNR. One of them has a developmental delay and the other is a typical child. So sometimes we would have these reflexes still retained, but it doesn't affect us, right? Because we can still have some of these as adults, but then we can have some children where it really affects their day-to-day life, or it never fully integrates. Now, my oldest son may have integrated his reflex as he went along in life, but this was him at about a month old, okay? And then you can see on the right-hand side, there's the typical ATNR. All right. So retained ATNR, what does this look like? We can have delays with our gross and fine motor skills, holding a pencil awkwardly. This is my son again, as he got older. This was him about 10 years old. This is my son that's on the autism spectrum, how he used to hold his pencil like this, funky grip. And you'll see why in a second. But he's much better now. He can hold his pencil, typical way since we integrated his ATNR. So potential effects on learning and behavior. Problems with eye-hand coordination, especially for fine motor skills, or gross motor skills and crossing the midline, not being able to cross the midline easily, or that hesitation of not crossing the midline is a big red flag for ATNR. So when you do cross crawls and you see kids going like this beyond the age of about 5 or 4, even 5 really, then that's a big red flag for me that they are still in that homolateral pattern and have not integrated their ATNR. Poor handwriting ability, again, because what happens is, and this goes along with the next one too, is this writing position. As we are turning our head and our arm wants to extend, we're going to build up compensations to keep this arm, or right arm, or left arm, whatever arm we write with, to keep our arm from extending, right? Or feeling like we're going to extend. So we find ways to do that. We compensate. So we might turn our arm like this. Some kids might go like this and they try and write with an extended arm, or they're turning their body because they don't cross the midline. So if they're right-handed, they're going to put their paper always on the right-hand side because they don't want to cross the midline. So it's a big issue, okay? Because we develop these compensations as we go, but what happens is we're developing compensations, we can make it happen. Like, so kids, they can write, but they're using all of this cognitive brain power for these compensations for something that a movement that should be automatic in the brainstem. We shouldn't have to cognitively think about, how am I going to hold my paper? And even if it's a subconscious action, which it usually is, it's pulling all that brain power that should be used for cognition and thinking and learning and all of that sort of thing for something that should be integrated in the brainstem and should be as automatic as breathing and swallowing. Okay.
Amy, can I interrupt you? Rumby from Zim has a question.
Sure.
Is the treatment the same for kids who presented with atypical reflexes as those who aren't developed or integrated?
Can you read that again? Is the treatment the same for
kids who presented with atypical reflexes as those who aren't developed / integrated?
Yes, because I would say atypical and not integrated are the same thing.
Great, thank you.
Yes, yes. So, you know, if I had a child whose ATNR was unintegrated, or I could tell was unintegrated by their movement patterns, then, or their behaviors and all of this, I would treat them the same as if I had someone who came in who was still able to do all of these things. But if I knew they had a retained ATNR, I'm still going to treat them for it the same way, because they're still using that brain power to work extra hard for things that they shouldn't have to, if that makes sense. Okay. A few more things. So they may hold the pen or pencil too tightly, again, building that compensation. Left margin space may drift. Poor eye tracking. So again, eye tracking, using both eyes together, being able to track left and right across a page. If our eyes do not work well together, then to track across a page, then reading is going to be very difficult. And if reading is difficult, then so is the comprehension and the fluency. So as we're reading, if our eyes are jumping or they're jumping lines like this, that's going to make all of that very difficult. Okay, so that affects the fluency and comprehension as well. Poor balance, because our left and rights are not working well together, difficulty catching and throwing a ball, because ATNR, left side, right side, and coming together to midline, we have to be at midline in order to catch and throw a ball. Poor bilateral skills such as tying shoes, mixed dominance patterns, meaning like we have a dominant hand, right hand, foot. We also have a dominant eye, ear, and brain. So if we have dominance patterns that are all over the place, that can cause confusion in the brain. I have a lot of kids who come in, they might throw with their right hand and write with their left hand. So every time, you know, the brain goes to pick something up or do, their brain is like, wait, which side am I supposed to use? And there's this confusion, right? So it's just, we want to have dominant sides. Okay. Next. So this is This is a really short little video, but this is that same little girl that you saw doing Superstars. This was her, like when I first started working with her. This is her working through her ATNR integration. She is not able to coordinate this top bottom movement, right? You see how her legs are lifting and she's got the cups underneath her, but she just cannot coordinate it. Okay. That was when I first started working with her. She made great strides. And so movements for the ATNR, the cross crawl, that was the one we did during pace. So just that opposite, opposite side. Lazy eights, or the infinity loop sign in general. The lazy eights in brain gym is I tell kids, put your thumb on your nose and you come out. You don't want to have an extended arm. You want to have a little bend in your arm, but you're coming up and around to the left to make this infinity loop sign. And as you're doing this, you're following your thumb with your eyes. Okay. So up and around to the left, we want to do it around to the left because when we write, think about the way we would write a lowercase letter is we're going to come around to the left. So if we're reading in English, right, and we're going left to right, we want to follow that pattern. We do one side, then we switch and we do the other hand. Okay, same thing, up and around to the left. We always do one hand, other hand, and then we do both hands together. We're going to interlock our fingers, cross our thumbs, and now we're doing it big. Gross motor. Okay. You can do these on like a board, like on a whiteboard or on an easel, and have the kids really use those gross motor shoulder muscles to do this. And they're doing it like that. Always use one hand, other hand, both hands together. Okay. And then just bringing in that 8 shape, you can bring in this lazy 8 shape in all sorts of different ways. So these are marble boards that the kids just that infinity loop, and they roll the marble board around it, using sidewalk chalk outside and making the 8s on the ground, or making big 8s like this and walking on it. Because if you walk on the 8 as you're walking on it, you're shifting your weight, right? One side to the other side as you come around. This is a great activity. Actually, when I have kids who have trouble like spelling or doing academic skills, I have them walk the 8 as they're practicing their spelling words. Or I have a little girl who's trying to memorize lines in a play, and I have her walking the 8 as she's reading the lines, because it helps get both sides of our brain activated to get that whole brain learning in. Using like a ribbon on a stick to do that in the air is another way to do that. Any kind of sensory, if you work with small children, you could do like shaving cream or things on the table, or sand table, things like that, rice, having them make the 8s that way as well. Okay. So some developmental movements, these are ones to just watch here. Snow angels is like, if you might not be in a snowy area, but we have snow around here in the winter time. And it's just that, arms and legs coming up together. Do you remember her? This is that same little girl. Remember her in the cups? Look at the coordination now of how she's able to do this movement, right? So when she was in the cups, she just couldn't even find that motor planning. And now she's just as fluid as can be, working through that. It's totally integrated her ATNR. She's finished with me now, actually. And then the next one is swords. So this mimics the movement of that reflex. So she starts on one side, right? Hands, arms flexed on the one side and bent on, straight on the other. And then we switch, holding each position for a few seconds, ideally, before switching. She's actually switching a little quicker than I'd like her to. Just holding that position and letting the body feel that position. But you see how it's moving all at once from one side to the other side. Being mindful of the time, we're wrapping it up, Kate. I think we're okay here. We got a couple more slides to go. This is an activity that you can do for a cross crawl. It's just a little song I do that I'll say it while we're a little chant we'll say while we're doing the cross crawl. And then when we get to the end where it says, I know it's time to stop, I'll have them like freeze. So they might be freezing mid cross crawl, right? And just bringing some of that balance. And when I see that great green light, I know it's time to stop. and let's just hold that for a minute and see if we can, you know, work some of that balance and vestibular system. Okay. Playful ways to integrate the ATNR, any kind of left and right play where we're, again, weight shifting, right? And just working those left and right sides to build that laterality. Cup towers or cup stacking. So I have kids use these, they're just plastic cups, and we build these really big towers. And one of the things we do is left hand, right hand, left hand, right hand, left hand, right hand. So we're building like with 100-something cups, and they're doing that left, right. And then when we knock it down, they get to do cup angels, I call them, right? So doing that angels in the cups. And then we're picking them up. And as we're cleaning them up, left hand, right hand, left hand, right hand. So just alternating the sides of the body. Monkey noodles are really stretchy, like toys that we can use, and you pulling the bands like this, right? Just left and right like this, and getting in that swords position. There's the marble boards being, marble boards being used on the knees. So he's just using his knees and his legs to move this around. Bean bags and scarves where we're, you know, just any kind of left and right, tossing it over in a rainbow arc. Bean bags, you can do that with scarves as well, which move a little slower, obviously, than bean bags. So it gives a little slower motion. Or doing a partner juggling type activity where you're throwing it to them and they're catching, you know, one hand, or you're crossing the midline and getting in that motion as well. Okay, that was a lot of talking. Does anybody have any questions or connections or anything for me?
This was amazing, Amy. This is a really great presentation. Thank you so much. There was a bunch of comments of people, you know, being like, wow, I'm, you know, very thankful of your presentation. But does anyone have any questions? You can take yourselves off mute. All right, well, thank you so much, Amy. This was amazing. If anyone has any follow-up questions, you can always email me and I will send them along to Amy. And I will send out a copy of the slides and with the recording later today. Thank you so much.
Thank you.